There is a significant amount of detail in this PowerPoint, and I'm not going to go into all of it, but is there for you as a reference if you want to know more about the details of chemotherapy. We're just going to talk about it briefly, but the details there if you want it. You don't need to look at it now. You can save it for the future. But for the diagnostic treatment of cancer, the main learning objectives are I want you to be able to describe the local potentially adverse effects of radiation, which is one of the treatments for cancer, paraneoplastic syndrome, which I talked about a little bit in the last section, and metastasis. So diagnostically, routine screening is important for early detection. The earlier it's detected, the better chance you have of surviving it. And the treatment that you follow after routine screening is to detect any further tumors. So self-examination, early detection, breast, testicular, and skin examinations are important. Blood tests that measure blood cell levels during treatment, sometimes tests that detect tumor markers like a PSA test. Things that also are included in routine screening are colonoscopies. Just recently, in the last couple of years, they changed the recommendations for your first colonoscopy. It used to be 50. When you turn 50, then they said, hey, it's time for your first colonoscopy. Well, they've changed the recommendations now and they've put it down to 45 because they're finding precancerous cells in younger people. And if you find precancerous cells in a colonoscopy and then they get rid of them in that procedure, then you don't have to worry about it from then on. So that's great. If you go in, when you go in for your first colonoscopy, they usually tell you, like, oh, we want to have you back in 10 years or 5 years or 2 years or a year. They'll give you some kind of time frame. If the good news you want to hear is that come back in 10 years. So you know, not everybody gets to hear that, but it is good when they say that. When they say come back in 10 years, it means they didn't find anything. So and wait another 10 years and see what happens. So that is a good thing. The other thing, so radiographic ultrasound, MRI, CT scans are methods of visualizing changes in tissues or organs. If they suspect something, they might up the ante and have you do some of these imaging tests. Cytological tests require biopsy or a cell sample. So when they get the biopsy, the cell sample, they're looking to see, are those cells differentiated? Are there tumor cells and is there a type? They might test them for growth promoter sensitivities, like estrogen dependent tumors. And histological and cytological tests are the most dependable confirmation of malignancy. So if anything shows up on your routine screening or your later imaging, then it's going to go to the biopsy, and that is the most dependable confirmation. So paraneoplastic syndromes, like I talked about in the last section, there are additional problems associated with certain tumors. The tumor cells release substances that affect either neurological function or blood clotting or have hormonal effects. And the biggest problem with that is that it distracts doctors from what's really going on. They think you have another problem. They don't know that it's a tumor causing that problem. So the example that's given in the textbook is the cells of a bronchogenic carcinoma may produce adrenocorticotropic hormone, leading to the signs of Cushing's syndrome in the patient, which is an adrenal disorder. So this syndrome is going to confuse the diagnosis of cancer and complicate the monitoring and treatment of the patient. So they're going to say, oh, it's Cushing's syndrome, not, oh, it's bronchogenic carcinoma. And so it delays treatment, unfortunately. So the cancer treatment that you get is going to depend on the specific cancer. So it's going to be possibly surgery, chemotherapy, immunotherapy, radiation, or a combination of the above. Other medical treatments for cancer may include bone marrow transplant, hormone therapy, or some type of targeted therapy. Immunotherapy is really effective for a lot of different cancers. Chemotherapy is very effective for a lot of different cancers. Surgery, certainly, if you have a localized tumor. The effectiveness of treatment is going to depend on the stage of the cancer and the health and type of client, the type of cancer and the health of the client. Many treatments result in long-term remission and some in cure, which is ideal. That's what we really want. Palliative treatment might be used to reduce pain in late-stage cancers, like the debulking of a tumor. So if the tumor is pressing on adjacent structures and causing pain, debulking the tumor might relieve pain, but it doesn't necessarily cure the disease. So that palliative treatment provides some relief of symptoms, but doesn't necessarily provide a cure. So the progression of cancer treatment, this is a graphic from the book. So you have tumor growth, signs appear, you get a diagnosis, hopefully you have early surgery, and best case scenario, you get cured. They might follow up the surgery with radiation and or chemotherapy, and then that may result in a cure, hopefully. If you have a resistant tumor that resists treatment, you might go through that cycle several times, and unfortunately, it could result in death. Or it could, so the later the treatment, the less likelihood there is of a good outcome, if you want to think of it that way. You can also have recurrences. It seems to be in remission and then it recurs. So cancer treatment is going to progress a little bit differently for each person. Surgery is the most common intervention for solid tumor cancers. So lots of different reasons why they're going to do surgery. I'm not going to go into detail on any of these. Radiation therapy uses high energy radiation to shrink tumors and kill cancer cells. It may be used as a curative treatment or a palliative treatment. Lots of different types of radiation. Radiation specifically targets fast-growing cells. So epithelial cells usually respond well to radiation therapy. Lots of different precautions. I'm not going to go through every single one of those. It's kind of interesting. The adverse effects of radiation, it targets fast-growing tissues like the mucosa and the lining of the stomach and intestines. So it makes changes in those radiosensitive tissues, potentially. Salivary glands may have permanent damage if they're affected by radiation. So that can affect your eating and your taste and everything. Fatigue is an early adverse effect of radiation. It tends to worsen a couple weeks after starting treatments, but it typically improves within days to weeks after the treatment. Reddening of the skin across the radiation site may become permanent because it causes darker pigmentation from the melanocytes in the skin. Later adverse effects can take months to years to develop, like normal tissue change to scar tissue causing fibrosis, and possibly changes in organ function if you have radiation across your chest. So because it targets those radiosensitive, fast-growing tissues, it's going to have more effect on those tissues. Chemotherapy, or chemo for short, it works by attacking and killing rapidly growing or replicating cells. It's a cytotoxic approach, meaning it's toxic to living cells. Cancer cells replicate quicker than most normal cells, but unfortunately, other cells that rapidly replicate can be impacted too, like the lining of the mouth and intestines, hair, and blood cells. So when somebody's going through chemo, they're usually watching their blood cells pretty quickly. Sometimes people lose their hair. Chemotherapy can be curative, supportive, maintenance, or palliative. Lots of different chemotherapy agents, usually given in combination, and they work to find the combination that works best for you. So I have tons of information about chemo in here, and I'm just going to skate by it. You don't need to know that level of detail right now, but it's there in case you want to know. Side effects can be pretty significant with chemo. You can have immediate side effects. You can have side effects that resolve soon after treatment, but some might be permanent. The reasons that side effects are common with chemo is because it's a systemic treatment. The chemicals that you're receiving are toxic, basically, and it's killing normal cells that divide rapidly as well as cancerous cells that are dividing rapidly. And the lysis of the cancer cells can cause side effects as well. And you can change functioning of normal cells like the cardiac cells, causing cardiotoxicity. And cardiotoxicity can arise for months to years after you had chemo, and it can also decrease efficiency of your organ system. So chemo is a drastic treatment, but sometimes it takes a drastic treatment to cure the cancer. Lots of side effects, lots of precautions. Hematopoietic stem cell transplantation, also known as bone marrow transplant, is used to regenerate a new immune system for when somebody's immune system doesn't work anymore because of leukemia or lymphoma. And so when basically lots of side effects, you can go through those if you want. I'm not going to expect you to know all these right now. Lots of precautions. You basically have to build yourself a new immune system. So you get a bone marrow transplant either from somebody else or from healthy cells of your own, and you build yourself a new immune system. And bone marrow transplant, when it's used, can be very effective. Hormone therapy continues to be used today in breast and prostate cancer. It's usually given along with or after other primary treatments, usually administered by injection or orally by pill. Targeted therapies work by interfering with specific cancer cell molecules to prevent growth and spread, like monoclonal antibodies. Molecularly targeted therapy is what it's sometimes called. The difficulty with targeted therapies is that the cancer cells eventually figure it out and become resistant to them. Immunotherapy is one that is kind of growing in use because it has been very effective for a lot of different types of cancers. Nutrition, lots of different factors contribute to poor nutrition in patients with advanced cancer. So working with a registered dietitian or a nutritionist is really important for someone going through cancer treatment. And they can help figure out. So sometimes it's like trying to support the person until they get through the cancer treatment. Complementary therapies can include massage, meditation, acupuncture. It's not listed there, but I know it's used. Counseling, exercise, therapeutic touch, art therapy, therapy dogs, anything. A lot of cancer centers these days are multidisciplinary, and they provide a lot of different complementary therapies to help people survive cancer treatment, basically. So this is the one main thing that I want you to get out of this is continued advances in treating cancer and improved methods for early detection lead to improved long-term survival rates. The 5-year survival rate in 1975 was 48.9% for all cancers. In 2011, it was 69%. So that's a good improvement. And that's for all cancers. In 2014, there were an estimated 14.5 million people living beyond a cancer diagnosis. And it's in the 10 years after that, till 2024, it has risen to almost 19 million. So cancer is no longer how it was originally classified, which was a grave disease with no significant curative options. The 5-year relative survival rates are combined for all cancer sites, for all races and both sexes. So people, I mean, there are certain types of cancer that are more survivable than others, but people are surviving cancer diagnosis longer. So it used to be you got a cancer diagnosis that was basically a death sentence, but that's not the case anymore. More and more people are surviving, and I think that is a great thing.